we are gathered together because we all concur that even one death of a woman during the intrapartum or postpartum phase is tragic, and even more tragic when that loss was preventable.
Just pulled a nurse to the side and I just grabbed her by both hands. I just looked her in her eyes and said, please, she doesn't look good. Can you please help us? And she looked me right in my eyes and she said, sir, your wife just isn't a priority right now. Your wife just isn't a priority right now. And that was the last time I saw my wife alive.
Despite spending more on maternity care than any country in the world, the United States now ranks 55th in maternal deaths.
Systems have failed because of denial, delay, and dismissiveness.
Today is the second annual Maternal Health and Perinatal Safety Symposium, and it is now a tradition to bring together a large number of stakeholders, consumer advocates, clinicians, to dialogue about what's been working well and where do we need to improve.
What we're doing here today is talking about who's vulnerable. It's women with chronic diseases, it's adolescents, it's women with no access to care, and to talk about disparities in health outcomes and interventions and strategies to improve maternal-child health.
Currently, New Jersey is 45th out of 50th in the United States in terms of maternal mortality rates. Given our incredible access to health care, our history with the pharmaceutical industry, there's really no reason for us to have such appalling rates.
The racial disparities within this epidemic are shameful. And in fact, African American women and women of color are dying 5 times as often as their Caucasian counterparts. So we've got a lot of work to do.
You make it clear that any baby who takes his or her first breath within the border of New Jersey is your responsibility, and you can and must do better.
One of the things that's so phenomenal about this conference, they've done a phenomenal job of bringing people together from so many different facets of maternal health.
You've got physicians, social workers, nurses, everybody who is touching these patients, who's going to have an impact on these patients' lives. And I think that's the holistic approach that we need to address to attack this problem.
The critical piece is to have all the involved parties work together. That's where you get your leverage. That's where you get your big impact.
I'm hopeful, right? The good news is that we can fix this.
That opportunity lies in eliminating health inequity gaps, ensuring that we're following best practices, we're being evidence-based, and health beyond the 4 walls of the clinical care system.
So I think our duty here is to affirmatively build a health system that supports the aspirations of women and their families to have a dignified childbirth experience that empowers and honors every woman and every child.
It's a very critical and a pivotal moment for us right now in the country to address and begin to develop true and impactful solutions to these problems.